New coronavirus cases in South Africa appear to be declining despite the relaxing of many restrictions. It also comes as government mulls ending the national state of disaster soon, despite some experts warning of a fifth wave next month or in May. We're joined now by the National Institute for Communicable Diseases Director, Professor Adrian Puren. Professor Puren, good evening to you. Thanks for your time tonight. Firstly, when we look at the numbers, what are the trends that we can pick up?
So I think the overall trends are still downward. I think just to alert your listeners and your viewers is really that we should really be monitoring the 7-day moving average. And so the overall view is that, in fact, the positivity rate as well as the numbers seem to be still on the decline, which I think is a good sign. And again, if you're looking at hospitalizations and deaths, these are also certainly on the decline overall. However, that does not mean we should be complacent. I think we should still be on the alert and be ready.
Professor Puren, you know, I remember just in the last 24 to 48 hours or so, there was a day where we had recorded, at least officially, one COVID-19 related death. And, you know, of course, the fact that it's a death is tragic. But certainly we haven't seen the numbers be as low as they are. I mean, do you think that we're at a point now where we can see even fewer deaths concurrently, or what's happening with the gathering of that data?
Yes, I think this relates to obviously to the current variant that is in circulation, and so things may be changed. We may have just been fortunate to have a variant where we have this marked uncoupling in terms of poorer outcomes in terms of hospitalizations and death. So although this is a good thing for us, I think we just need to be cautious that and not lull ourselves into false sense of security that this could well change. But I think it is really good. But I think it brings your point is still that people are being hospitalized and there are one or two people, or not one or two people, there are people that are dying. And that just raises the point that I think we need to emphasize that the non-pharmaceutical interventions, in particular the wearing of masks, and of course vaccination, complete vaccination and boosters, especially in vulnerable groups, I think is really critical as well. We're also approaching the winter season, sorry.
Sure, go ahead, Professor Puren, yeah.
Yeah, I think we're also approaching the winter season. I know we've not really had conventional flu seasons, if you like, but again, I think we just need to be cautious that we are certainly seeing flu in circulation. So again, I really would like to urge people, if the opportunities are there for influenza vaccination, please to take advantage of that as well.
You know, you talk about the current variant that's in circulation, and I wonder, because the symptoms that people are experiencing are not as severe as we've seen before, is that impacting the rate at which people are actually getting tested for COVID-19?
That is a possibility. I think it's been very difficult for us to always tell what is the urge for people to seek testing, and I think that's why you're probably seeing this very variable testing rates that we are currently seeing, and it may well be that the symptomatology may not be severe, or people are saying, well, it's likely that I do have that I am infected with Omicron, so therefore I'm not going to be testing, or that there may be other viruses in circulation, because this is the season for that people are actually not testing. So I think it's really then really critical for us to keep an eye out for the proxy indicators. And then, for example, the wastewater surveillance, I think, is also going to be an important factor, as well as monitoring the variants that are currently in circulation.
So what do we need to keep in mind then, Professor Puren, going into the autumn-winter months?
Yep. So again, I think we need to know that, yes, we still have circulating virus. We've not fully vaccinated, although we have had large, substantial resurgences, and therefore now large numbers of people have been exposed, infected, and have a degree of immunity. But there are individuals who can be reinfected because of waning immunity, and there are people who have not been vaccinated. So I think as we go into the winter months, we should still encourage people to be vaccinated. I think it's really unfortunate that we're going to waste all those vaccines that we were really crying for a few months back. So I think let's take advantage of that. And individuals who are at high risk, not only to be vaccinated for COVID-19, but also for influenza as well.
The NICD's director